Hello and welcome to another episode of Campus Stories. I am your host, Vince Russo, and today we have a great show planned for you. On March 23rd, 2010, the Affordable Care Act, or Obamacare as it is more commonly referred to, was signed into law. After a lengthy process of analyzing its constitutionality, the law was upheld and put into effect on New Year's Day of this year, 2014. Surrounded by controversy and debate, this law is not only far-reaching and impacting towards the entire population of the United States of America, but confusing as well. So to make sense of it all, we are very pleased to be joined by our guest, Dr. Lynn George, Associate Dean of the School of Nursing and Health Sciences here at Robert Morris University. So thank you for joining us today.
It's my pleasure to join you today.
So to jump right into things, with Obamacare starting to make its impact in America, what changes will Americans start to notice right away or perhaps already realizing?
Well, I think some of the things they're already realizing. The extension of health care benefits to children up to 26 years of age, and now after the first of the year, not restricted as far as health care benefits are concerned for pre-existing conditions. So those things are apparent, and I think those are among the most common things that people know exist in the Affordable Care Act. So that part of the answer to your question. As far as changes, part of what the Affordable Care Act is about is linking payment to the quality of care. So that's what I think people will see moving forward, is that there'll be more emphasis on what are the outcomes, and there is more emphasis right now on looking at the quality of care related to the patient and also the patient's perception of that quality of care.
What does Obamacare mean specifically for nurses, since that is your specialty?
It is my specialty. Thank you for asking me that question. A lot of good things. And as I mentioned, because Obamacare, or as I prefer to call it, the Affordable Care Act, is linked to the quality of care, it's really an opportunity for nurses to shine. Nurses have long been the most respected of the healthcare professions, and they continue to be. And that is because their focus is really on the quality of the patient care. So that's very closely linked to part of what the Affordable Care Act is all about, is that quality of care. And nurses have the ability to really focus on that patient experience. And now's their time to shine, in the sense that now everybody's interested in the quality of that patient experience, so that will bring nurses to the table with other healthcare professions to be partners, more full partners, and to also be leaders in those initiatives because they have the expertise to really bring that to the table.
So what could possibly be then some of the cons for nurses with the Affordable Care Act?
It's going to change practice. It's going to change the location of practice. I'm not sure that the public is as aware as healthcare professionals are, but the number of patients that are hospitalized is declining. Hospitals and hospitalizations are confined now primarily to acute, very sick patients or those who have been injured. And more of healthcare is shifting to the community, so that means that the practice of nursing and other healthcare professions will need to shift to community-based care, more focused on wellness issues, more focused on preventing readmissions to hospitals, and that the sickest of the sick will be in the hospital, but there will be less positions for nurses within acute care institutions, and more positions that will be new and created in community-based provision of healthcare.
When you talk about community-based, are you talking about like your local doctor's office? Or?
That's part of it. That's primary care. And there's certainly a role, and always has been, for nurses in a primary care office. But I'm also talking about things like rehabilitation facilities, long-term care facilities, wellness centers, home care, and areas that we haven't yet developed that'll be necessary to keep families and patients well in their homes and in their communities, as opposed to sending them to hospitals for every episode of care.
You talked about the quality of care. What specifically can you elaborate on as far as the quality of care and how that will be influenced?
Well, quality has always been important related to health care. But as I said, now it's not only the right thing to do, but it's also something that's tied to reimbursement. So there's a carrot, so to speak, and there's a stick, so to speak, because not only do we want to do the right thing for our patients, but there will be consequences for healthcare systems that don't do those right things and can't demonstrate that they have achieved the outcomes that they should. And this information will be, and is now, in many cases, available to the public. So the public will be able to look at that scorecard, if you will, to see what's actually happening in their healthcare system and look at what the outcomes are.
So as a field and an industry as a whole, how does this legislation impact the entire overall medical field?
Oh, it changes it in a lot of different ways. The outcomes measurement piece of it, but also the focus on looking at keeping patients healthy and keeping them out of the hospital will be an increased focus for physicians, nurse practitioners, physician's assistants who provide that primary care of level of patient care. It'll also shift, as I mentioned before, where patient care is delivered. I think the public is fairly aware that before patients or families and individuals had coverage, or as much coverage as they will, hopefully, with the Affordable Care Act, that if they were seeking help for a condition, they waited until they were quite ill if they didn't have coverage. So they didn't go to their physician because they weren't covered and it wasn't paid for and it was expensive. So they waited until they were much sicker and ended up in an emergency room, for instance, for treatment of something that could have been managed much better if it had been addressed earlier. So this is going to be a good thing for people to have the opportunity to really address health concerns much earlier before complications arise or before they become sicker. It's much easier to treat something if you can catch it earlier as opposed to later.
Well, that will lead us to our first break here on Campus Stories, but don't go anywhere because we'll be right back talking more about the Affordable Care Act.
These boys are my heroes. They come every week to spend time with my children.
At Robert Morris University, every student is expected to reach out to others.
They can teach them something no one else can.
Wisconsin.
They're role models to the children, and homework comes way before sports. Their grades have improved, and their lives are just a bit richer.
Okay.
What they do for my kids is truly wonderful.
Change someone's life. It changes yours forever. Robert Morris University.
I call them my lifeline.
People don't realize how quickly you can end up on the street. One thing happens in your life, medical bills you can't pay, you lose your job, and that's it.
At Robert Morris University, every student is expected to reach out to others.
We went to DC to work with the homeless. They sell a newspaper called Street Sense. Thought I'd help.
But if you want to give more, you can.
This person came up to me and said, "Get a job." And for 2 hours, I felt what it was like to be homeless.
Good morning. $1 help on.
Some of the other students said, "How can we change this?" And I said, "Sometimes you can't change the world, but you may be able to change one person's world." My dream? Open a psych clinic for people on the street.
Change someone's life. It changes yours forever. Robert Morris University.
Welcome back to Campus Stories. Dr. Lynn George, Associate Dean of the School of Nursing and Health Sciences, has graced us with her presence as we talk about the Affordable Care Act of 2010, better known as Obamacare, and its impact on our nation. So thanks again for joining us today.
My pleasure.
And I'm going to jump right back into it. How will the Affordable Care Act impact salaries, working conditions, and the job itself?
My expertise is nursing, so that's where I'm going to focus my response to this. It's going to change the job and the work of nurses a bit. again, it's going to focus on what nurses do well, which is that patient care experience. But it's going to shift for nurses who are more often now practicing in hospitals to community-based agencies. And it's also going to demand a higher level of education for nurses. The complexity of healthcare systems in our country and the complexity of healthcare is going to require that nurses are educated about economics as well as health policy and how that influences how they're going to practice. In the primary care center or delivering care, which you typically thought of going to see your physician or your PCP, there's going to be an increased demand. As more patients and more families are covered by healthcare insurance, they're going to access the system, and where they're going to access the system is through that primary care system, or that entry through a private practice or through a physician practice, or that setting. There aren't enough primary care physicians to meet the anticipated need. Therefore, there's going to need to be a team of healthcare providers that will include nurse practitioners and physician's assistants. So there's an increased demand for, in particular, nurse practitioners to serve in these roles, and there will be an increased demand as time and this Affordable Care Act rolls out and more people have access. So that in order to meet the demand, we'll need to have nurses educated as nurse practitioners. We'll need to have nurses in general have a sophisticated level of education that prepares them for the roles that they're going to be assuming in the new era of healthcare delivery in the United States.
What exactly will that level of education be?
It depends on what we're talking about. If we're talking about nurse practitioners, by 2015, nurse practitioners should be educated at the doctoral level. So the Doctor of Nursing Practice is the preferred level of education related to nurse practitioners. If we're talking about the variety of other roles, they could have graduate preparation at the master's level, for instance, as educators, to be community-based educators, to be the first level of education for an academic institution. And then at the pre-licensure level, the recommendation and the trend and motivation is to move to the baccalaureate level of education. As I mentioned, there's a complexity to the delivery of health care, and that's only going to increase. And baccalaureate preparation helps to give an individual who wants to be a nurse and practicing now and for the future the requisite level of academic excellence and preparation that they need for those new roles.
And could you elaborate a little more on the economic side of it and how economics will tie in and be important for nurses?
In a couple of ways. Nurses are increasingly valued in the healthcare system today, so that's part of looking at the value that they bring to the organization, and that's a piece of the economics. Nurses also have a unique skill set and focus that will help healthcare organizations to be more efficient and effective. They can problem solve, they can look at the lack of efficiency in the delivery of patient care and help to develop new ways to deliver that care that's economically more feasible. And they also need to be aware of how healthcare systems run as an organization. With advanced education and changed education, they'll be better prepared to lead those initiatives that are necessary to make sure that healthcare systems are both of high quality and economically feasible.
You've talked about several times throughout the show that the care will go up, the quality of care based on location and other things like that. Could you elaborate just a little bit deeper on what the average everyday citizen can expect as far as the better quality of care?
Sure. Quality of care is a focus, and the patient is now a focus. For nurses, the patient was always the focus, but for healthcare systems, they weren't. So I think that patients who are hospitalized or patients in community-based healthcare delivery systems will notice that focus is more on what they need and more individualized to their own particular types of problems and issues, and that their opinion will matter. They'll be more engaged in the healthcare team. There'll be a person that, it sounds silly, but in the past they weren't always considered as far as what it was that they needed to get better, how they preferred their healthcare to be delivered, what were the barriers and constraints to them getting well. we weren't always as good at asking those questions or even thinking about that in the past. We'll be better at it as it moves forward. And we'll be looking at standardizations of things. We've always, as a healthcare profession, moved in the direction of looking at what is best practice. But that's even more important now as we move toward quality initiatives that are also cost effective, so that they may not see that so much as the healthcare professionals will, but they'll see more interest in their participation in that process of making the quality of care better.
All right. Well, we are headed to another break, but don't go anywhere. We'll be right back with more on Campus Stories.
Nicaragua is a completely different world. We were there to bring nursing care to some desperate people.
At Robert Morris University, every student is expected to reach out to others.
The very first person that I met was David. Kept saying, "You have to come to my house and watch me play my trumpet." You could tell from the look on his face that it was just his most prized possession. I get back home. A few weeks later, I got a message that a gang had broken into his house at night and they stole it, which was his life. So next trip back, we gave him a new one. The look on his face was just complete disbelief. He just absolutely couldn't believe it. And to be able to do something like that was one of the best moments of my life. He said he'd never forget us.
Change someone's life. It changes yours forever. Robert Morris University.
These boys are my heroes. They come every week to spend time with my children.
At Robert Morris University, every student is expected to reach out to others.
They can teach them something no one else can.
Wisconsin. Wisconsin.
They're role models to the children, and homework comes way before sports. Their grades have improved, and their lives are just a bit richer.
Okay.
What they do for my kids is truly wonderful.
Change someone's life. It changes yours forever. Robert Morris University.
I call them my lifeline.
Welcome back to Campus Stories with today's guest, Dr. Lynn George. Today we are discussing the Affordable Care Act of 2010. So, how will the Affordable Care Act impact the curriculum of nursing students in American schools and universities?
Even before the Affordable Care Act, there were recommendations for transforming the education of nurses in the United States, both from the Institute of Medicine and from other works of research related to how we were educating nurses. It aligns itself very well with the Affordable Care Act and the emphasis on quality and enhancing the knowledge of nurses and the education of nurses to really encompass an understanding of organizations and budgets and financing and the financing of healthcare, as well as health policy and the impact. This hasn't been something that has been included in curriculum related to educating nurses in the past. In fact, there was even the thought that, I don't want to think about those things, I just want to focus on the care of my patients. But it's clear that these things influence the patients and the care that's provided, so it's important for nurses to have that kind of education as part of their preparation to go into healthcare systems, as well as to take leadership roles. So an enhanced focus on leadership for nurses. And then the idea of the complexity of healthcare systems and the complexity of the conditions that patients face. We need to give them a broader education related to that. That includes, at this point and for the future, looking at community-based education, not focusing so much on preparing nurses to work in hospitals, but preparing nurses to work in the healthcare arena or system that's beyond hospitals.
Now you talked about how the nursing jobs will continue to require more schooling and more experience, are programs around the area and around the nation going to kind of push students towards a curriculum that prepares them for more graduate and doctoral studies?
Yes. Certainly that's part of it, and part of what is called for in the transformation of nursing education is to move nurses along that education curriculum continuum, so to move from baccalaureate preparation to graduate preparation and to doctoral preparation. Right now about 1% of nurses are educated at the doctoral level, and somewhere around 10% are educated at the graduate level. There's more need for those with advanced degrees to lead and to direct the profession of nursing as well as healthcare systems moving forward. Clearly they have a role and an important role, so we need to make sure that they have the right educational preparation for that. And then you'll see an increase in the need for nurse practitioners, so that type of education is certainly one that we need to look at. How can we increase the capacity? How can we prepare more nurse practitioners within the constraints that exist and the competition for resources and placement and faculty?
Now, you said 1% at the doctorate and 10% at the graduate
level.
What kind of number would you, off the top of your head, think would be one that they're kind of looking for?
Well, the IOM is very specific. They want to double those numbers. So from 1% to 2% for doctoral preparation.
Okay, and with Robert Morris being a leader of business and things like that, do you think it will attract more students now that more of a business side is coming out on the nursing front?
Well, I sometimes jokingly say that nursing is our business, and we need to understand the business of nursing and healthcare systems. So it's a perfect marriage. Our students take courses in economics, they take courses in healthcare economics and policy, healthcare policy, so that we know that these fundamental principles or these expanded principles as they move forward are important. So we tap into the School of Business and the Health Services Administration program that's actually within our school to provide these additional courses. So it's a great collaboration where we share courses across the university to help provide that foundation that our nurses need.
And kind of continuing with the education-based type thing, how does this reformation of all things nursing impact students that will possibly look into making nursing a career as the generations continue to flow through?
We have to remember that I'm prejudiced. So I've always thought that nursing is a fabulous profession. I've been a nurse for a long time, and I've done a lot of different things. Very satisfying things with my career as I've moved forward. Never been bored, always had employment, and always had the satisfaction of doing something as a nurse that was respected and meaningful. Moving forward, I see this as a continuation, but also the idea that nurses have long focused on the excellent patient care experience. And as I mentioned before, that's now valued by all the people, all the stakeholders, so that it's a time for nurses to shine, to really bring to the table the things that they do best, and to have that valued, and to have the outcome for patients improve, and to see that in such a tangible way. So I think it's a really exciting time to be a nurse and to have the recognition that they've long deserved as a partner in this team of delivering health care that provides patients in the United States with the best health care possible. They don't currently have that. We're moving in that direction.
All right. Well, we will be back here again in a minute. We're going to another commercial break. We'll have more from Dr. Lynn George on Campus Stories, so don't touch that dial.
G-Morning, sunshine. Wakey, wakey. Text me. Are your parents home later? We can hang. LUV, love you. JK. Holla back. Holla back. Holla back. Are you with your friends? That's lame. We're in a huge fight right now. XO. What'd you dream about? Something I did. Are you on your way to the mall? I'm lonely. Nude pics. Send me some. Text me.
I'm starving. What's for breakfast?
Guten Tag!
Johannes, Ross!
I bring you
enriched raisin blossoms, fortified with increased test scores and creative problem-solving skills.
It's good!
And good for you.
Bobby? Susie?
Don't worry, that's just the power of the art.
Feed your kids the arts. For 10 simple ways to learn how, visit AmericansForTheArts.org.
You ever think about buying a bigger place?
Just waiting for a visit from the credit fairy.
There is no credit fairy.
How else will I get a better credit score?
Look, you keep your credit card balances low and only open a new card if you really need it.
No fairy?
There's no magic to improving your credit, but there's help, and it's free. Go to creditfairy.org.
Yes, ready.
Oh, come on, Randy. Animal shelter, here I come. And no, I'm not crazy or emotionally damaged. That's a stereotype. I just belong to a total loser. I'm a good dog. So if you want a pet, adopt. And if you see Randy, tell him he dropped his wallet.
Welcome back. You're watching Campus Stories on RMU TV. Today we're talking about the Affordable Care Act, betterly known as Obamacare, with the Associate Dean of the School of Nursing and Health Sciences, Dr. George Lynn. So,
Lynn
wow,
George.
that's a mouthful. Guess that's what happens when you're successful. So, getting right back into it again, the Affordable Care Act permits children to remain dependent on their parents until age 26, 27, in that range. And how do you think students should feel about this, knowing that they're covered up until that age?
I think students should feel good that they're covered up until that age. I think parents should feel better. I'm the parent of 5 children, and I didn't have the benefit of the Affordable Care Act when they graduated from college, and there was that interim when they weren't employed. That was a really risky time for them, one in which I paid the insurance so that I was sure that they were covered. As young, healthy people, they weren't so sure that it was an important expense and weren't willing to spend the money to cover themselves. But as a healthcare professional and a mom, I knew that it was important that they be covered should there be a problem or an issue for them. So I think it's a good thing. I think that's one of the best things about the Affordable Care Act is to have transitional coverage for that period of time, in addition to coverage for others.
And I'm sure it provides that security blanket as a parent, knowing that your children are covered up until that age, especially since coming out of the college with the economy starting to bounce back, but still in a recession, giving them the opportunity to not worry about that as they try to find their way with their careers.
Indeed. And although they think of themselves as invincible and not likely to have an issue related to health care, you don't know. And accidents and injuries can happen at any time, in addition to catastrophic healthcare conditions. So it's important to have the appropriate coverage so that you have the appropriate access, and again, that you don't delay those routine screenings that can really identify things early.
And just to wrap up very quickly, any last comments or thoughts that you would like to get onto the air before we end up?
Oh, that gives me an open opportunity. I guess I'll take the opportunity to say that this is a wonderful time for nurses and for nursing education, and that I encourage those who are interested in nursing as a profession that they have a vast array of possibilities for themselves as far as this healthcare profession is concerned. And back to your topic of the Affordable Care Act, many of the things that are associated with the Affordable Care Act related to quality and outcomes were already things that the healthcare system was moving toward. This just helps to support those initiatives and to hold us all accountable for the quality of the care that we provide in the healthcare systems in the United States.
Well, that is all the time that we have for today here on Campus Stories. On behalf of our guest, Dr. Lynn George, and our always awesome technical crew, I am your host, Vince Russo, and we will see you again next week.